Hi, I'm Dr. Gvantsa Khizanishvili, and this is Global Health Unpacked, a weekly OncoDaily interview series spotlighting the latest global health trends, with leaders sharing the future of global health and cancer. And today, I'm joined by Lisa Stevens, Director of the Division of Program of Action for Cancer Therapy at International Atomic Energy Agency, IAEA. Our focus today is on National Cancer Control Plans, NCCPs, and why having costed, implementable plans developed and delivered with a strong stakeholder engagement is essential for achieving real impact in cancer care. Lisa, welcome, and thank you so much for joining us.
Thank you for the opportunity to talk about national cancer control plans.
It is so essential that national cancer control plans are often described as foundational for strengthening cancer care systems. From your perspective, why it is so important that NCCPs are not only well designed, but also fully costed and backed by a very clear implementation plan?
Well, thank you very much for the question. I do think now it's very important that countries have a strategy where they can improve cancer prevention, diagnosis, and treatment that really reflects the current capacity of the country. We've seen since the 2011 high-level meeting on non-communicable diseases that more national cancer control plans are being developed. However, we need to make sure that these plans are funded and implemented. And in order to do that, we need to help countries in creating a national cancer control committee or individual that's responsible, and that they would engage a broad coalition of stakeholders. When the International Cancer Control Partnership did its second global review of cancer plans, we found that only 7% of plans involved the Ministry of Finance in the development of the cancer plan. And making that link early on in the development process to the funders is important. And we also saw that only 2% of the cancer plans involved the private sector in the implementation, and there was no media involved. So it's really important to look at these other stakeholders for their role in not only development, but implementation, and carry over development team partners into the implementation process.
That's so true. And it really highlights that it's really important that not only there is a very strong technical expertise when it comes to NCCPs, but these plans are financed and sustained over time. So building on that, where do you see most common challenges that countries face when moving from NCCPs on paper to implementation in practice?
Well, we're seeing right now that grant funding is really harder to secure than it has been in the recent years. And many countries are facing a greater burden from cancer. 70% of the burden from cancer is seen in low and middle income countries. And we need to be sure that there's a link between early detection and access to treatment. So starting with screening is not the way for most health systems in order to achieve a success in reduction of cancer mortality, because early access to treatment can be more cost effective, but also has a greater chance of saving people's lives.
Thank you, Lisa. It really is important. It brings me to one of my favorite topics, which is stakeholder engagement. You highlighted in the beginning of our conversations that a lot of times countries struggle to include and effectively include different stakeholders. So from your perspective, what does that effective stakeholder engagement actually looks like in practice? And where do countries more often face challenges in making it work?
Well, it really, I think one of the challenges defining the roles and responsibility of the different stakeholder groups. We talk about resources, which are not only financial, but also human resources. So what can an organization or a ministry outside the Ministry of Health, what can they provide in that development to implementation shift? I think one of the stakeholder groups that's often overlooked but is really important is primary healthcare providers. How can we include them in the understanding of the signs and symptoms of cancer so that their patients that are not in the cancer system yet can be identified early? And we also need to look at ways to include support for cancer treatment and cancer diagnosis in universal health coverage benefits packages.
Mhm. That's so important. And it brings me to what's next. So looking ahead, what are some of these key shifts or priorities that countries should be focusing on when ensuring NCCPs remain relevant in these changing realities and also implementable and aligned with these evolving cancer trends?
Right. So as I said at the beginning, they need to fit the country context at the moment. And so while I think plans can be ambitious and cover several years, they need to start where the country is, understanding what the human resource capacity is and what it needs to be for future expansion, what facilities are available, and again, how the different services can be linked together, not in a siloed way, but in a more integrated manner. And so I think if a national strategy takes those points into consideration when starting, there's a higher likelihood that the plans will be implemented and funded, and again, will lead to lower mortality.
That's really, really important. And before we wrap up, I would like to zoom out. And if you could highlight one practical lesson from your experience, what from the successful implementation of NCCPs, and what are a couple of these key takeaways from that led NCCPs to be successful?
So I do think that, again, having a cancer plan is fantastic. When a country has a plan and then moves into the second iteration or third iteration, taking a moment to pause, reflect on lessons learned, what worked, what was able to be implemented, and how can the country build on that success? We've seen countries that have built monitoring and evaluation frameworks, had assessments done in the middle of a cancer plan implementation to really make sure that everything is on track. And if not, what is the appropriate course correction? So I think that constant reflection on the plan and making sure that it's fitting into development of programs is essential.
This is a great message to wrap up. And this really gives us the perspective our work never stops, right? So it's a very long-term commitment. Lisa, thank you so much for sharing your insights and for your leadership in supporting countries to strengthen cancer control. Thank you for watching Global Health Unpacked with Dr. Gvantsa Khizanishvili, and we would love to hear from you. How are NCCPs being developed or implemented in your country and your context? Share your perspective and follow OncoDaily for more conversations like this.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.